What's up everybody, welcome to this channel, and here we want to learn everything about mental health and psychiatry. So my name is Grace, I'm a registered nurse in mental health and psychiatry, and today I want us to talk about neurodevelopmental disorders. So in every condition, the first thing that we always have to talk about is the definition. So first, what is the definition? What does neurodevelopmental disorder mean? So neurodevelopmental disorders are a group of conditions that onset during the developmental period, basically before the child starts going to school. So these conditions are characterized by deficits in personal, social, and even occupational functioning. So when you talk about neurodevelopmental disorders, the diagnosis requires both symptoms and impairment in certain functions. And we will talk about the examples. I'll give you the examples in this video, and then in our next video we will talk about each and every one of them, about their diagnosis, how to diagnose each and every one of them, the signs and symptoms, and how to manage any patient with these conditions both at home and in school. So what are the examples of neurodevelopmental disorders? One, we'll talk about autism spectrum disorders. So this autism spectrum disorders will, a parent or a guardian will always notice something different about their child. That is social communication, excessiveness of repetitive behavior, and instances of sameness and restricted interest. And restricted interest. So when you as a parent notice some of these differences in your child, or when your child is too much attached to something, or the social communication skill of your child is not according to the developmental age and how the child should communicate at a certain age, as a parent you should seek medical advice and look for a psychiatrist and for medical attention. That is one, autism spectrum disorders. And the next one is ADHD, attention hyperactivity disorder. That is attention deficit hyperactivity disorder. What is it? When you notice your lack of attention, your child has a problem with paying attention, misplacing things, and so on and so forth, like fidgeting, like this is fidgeting. So when you notice some of these signs in your child, one thing you have to do as a parent is to seek medical advice. Yeah, or even if the child has already started to go to school and the teacher notices these things, you as a teacher, if you're a teacher and you're watching this, the first step you should take is to advise the parent to take the child to a specialist. The third condition is OCD, that is obsessive compulsive disorders. So you'll notice that your child will always feel distracted when things are not in a specific way. They'll keep checking the door before they sleep. They'll check the door about 10 times to 20 times if the door is locked. When they place something somewhere and whatever they place somewhere is moved a little bit, they'll notice it, and it will cause some instances of disorder in their mental functioning. Like they like things in a certain order, and a little bit of disorder will cause them to be hyperreactive. And the fourth, the fourth condition is intellectual developmental disorders. When your child has a problem in problem solving, learning, communication, social skills, basically everything connected to their intelligence, then that is according to age. For instance, when your child is 2 and they still don't know how to do some certain, uttering some words like mommy, you have to seek medical advice. And problem solving. When your child is about 5 years and they still can't feed themselves, and they still can't know when to call for, like when they want to go to use their toilet or the washroom, then that will call for medical attention. The child needs to seek medical, the parents need to seek medical advice from a specialist, so that their specialist can rule out some of these conditions and teach them or show them how to cope with their child. And the fifth one is communication disorders. When your child is stuttering, your child can't, like, communication basically, can't pronounce words properly. When your child has something with their verbal communication and you know what I mean, verbal communication basically, then you should seek medical advice. That is when the child is already 5 and the child should be school going, and they have some deficits in communication that are not supposed to be there by the age of 5, then you as a parent need to seek medical advice. So given these conditions in general, that is autism, OCD, ADHD, communication disorders, and IDD, that is intellectual developmental disorders, I've given them in general because I'll teach them to you in deeper level in the next video, because they are quite detailed and I wouldn't want to rush you guys into these conditions. So yeah, that is all for this video. I hope you like it and I hope you've learned something. If you have any question, you can always ask your question in the comment section. I'll be glad to answer. So thank you for your time. Thank you for your time. See you in the next video as we learn more about these conditions. Bye, and see you in the next video.